Dr. Matsunaga, thank you for joining us today. There has been a lot of discussion in the news about PSA testing. What should men know about PSA tests and prostate cancer?
What men should know about PSA testing is that PSA testing is still strongly recommended by the American Urologic Association. We believe that with proper interpretation and use of the PSA test that can aid with diagnosis, with staging, risk assessment, and with post-treatment follow-up of prostate cancer. Prior to PSA testing, almost 2/3 of men who presented to us had advanced or metastatic prostate cancer. Since PSA testing, there's been a 30% decrease in prostate cancer deaths.
What is a PSA test?
PSA is a blood test that stands for prostate-specific antigen. It's an enzyme that's produced only by the prostate. While it is not specific for prostate cancer, it can help us with the diagnosis of prostate cancer.
So on PSA tests, should men continue to get PSA tests? We've heard a lot in the news about whether or not you should get a test. What do you recommend for your patients?
We absolutely recommend men to get their PSA testing from age 40. This should be done annually. It's a way for us to screen for prostate cancer. Since the advent of PSA testing, prostate cancer deaths have decreased by 30%. Prior to the use of PSA testing, almost 2/3 of men coming in the door had advanced or metastatic disease. So we do believe that PSA testing can help us with early detection and potentially improving the quality of life of our patients.
Perfect. So if a man is diagnosed with prostate cancer, what do you recommend?
The first thing that I recommend when a man gets diagnosed with prostate cancer is to learn more about prostate cancer. Fortunately, prostate cancer is a slow-growing cancer, and it affords men the time to read up about it and to ask their physician more about prostate cancer and their potential treatment options.
When someone is diagnosed with prostate cancer, is there anything else that they should consider, or what kind of options do people face with prostate cancer?
Options for cure for prostate cancer include surgical therapy for the prostate to remove it, or radiation therapy to the prostate.
One of the questions, around prostate is PSA testing is the tendency potentially for over-treatment. What do you say about that?
Absolutely. One of the criticisms of PSA testing is that it leads to overdiagnosis and potentially overtreatment of prostate cancer. So because of this, one of the things that we are looking into is active surveillance of prostate cancer. This means not to jump into surgery or radiation therapy, but actually to keep a close eye on the cancer to make sure it's not progressing.
Dr. Matsunaga, are there any symptoms of prostate cancer?
Typically, there are absolutely no symptoms of prostate cancer. When we're making the diagnosis of early stage cancer, most men are completely asymptomatic, meaning they feel perfectly fine and have no outward symptoms of feeling sick or feeling like they have cancer. This is why it's important to get regularly screened for prostate cancer with a once-a-year PSA blood test and digital rectal exam.
Doctor, if someone has an elevated PSA, what does that mean?
When a man comes in with an elevated PSA, it doesn't necessarily mean that they have prostate cancer. The PSA test can be elevated in things such as infection or irritation to the prostate. So elevated PSA cannot necessarily mean just prostate cancer.
We hear a lot about supplements as a means to prevent or cure prostate cancer. Do you think any of these work?
Yeah, there are many supplements that are advertised in their use for prevention or treatment of prostate cancer. However, there's no supplement on the market that we know of that can prevent or treat prostate cancer. In fact, one of the studies looked at vitamin E and selenium in the use of prevention of prostate cancer, and it showed no benefit in preventing the cancer, and the men who took vitamin E actually had a small increase in their risk of prostate cancer. For this reason, we do not recommend use of any supplements for prostate cancer prevention or treatment.